Now, lung cancer is the leading killer of both men and women in the world. Cancer of the lungs takes more lives every year than breast, colon and prostate cancer combined. On this week's What's Up Doc, we'll further study the ins and outs of this condition.
As you know, cancer of the lung is number 2 or prevalence, frequency that we see, and it is the first killer in terms of mortality. People die from lung cancer is equal to those die from breast, prostate, colorectal cancer and pancreas put all together. So it's a major problem. Now, to deal with that issue, we have 4 stages. We have prevention, we have early detection, we have treatment, and we have terminal care facilities. Now, we talk about prevention, for any cancer to happen, especially in the lung, you have a latent period. So what happens today does not show tomorrow like infection. What the damage that happens today may appear as cancer in 20 to 25 to 30 years, right? So that's what we need to deal, and the best way of dealing with lung cancer prevention is anti-smoking campaign. We need to say, stop smoking altogether. Now, smoking is bad, full stop. This is one major issue that affect prevention, and that's what we see in the European developed countries and the states, that lung cancer in male, it's coming down for the last maybe 10 years. While in women it's still going up because they haven't stopped, they're not strong in stopping smoking as the male. Now, even if we do prevention, we won't see that now. So what we can do now is to deal with early detection. And early detection, there are many ways to do it. By chest X-ray, which is questionable whether it's beneficial or not. Now we have the low dose CT scan, which shows some promising data. If we can do mass screening, that's how we combat TB, because we did that, and with vaccination we control TB. Now we need to do it with but it's this very expensive program. So you have to select people who you can get benefit from early detection, like heavy smokers, like having other comorbidities, people exposed to other industrial things, toxicities, toxins, and so on. Pollution type, because smoking is the major factor, but it's not the only factor. And if we catch it in early stage, then it's curable. Now, next come to that is the people who have the disease, which is the most common one at the moment, because they come with locally advanced. Patient who injected themselves, heavy smoker, they have cough for a long time, they don't go to doctor, or go to doctor and misdiagnosed as infection. So we have to have a high suspicious awareness among doctors as well. So anything that does not respond to antibiotic for a week or 2, then you have to get more investigation to see whether they have cancer or not. Now, this we have advanced a lot. We have advanced in terms of the surgery, in terms of histology when we look at the tissue under the microscope, in terms of medical treatment, in terms of radiotherapy, and in terms of the target therapy, and the latest are the immune therapy. Now, we have advanced a great deal in the last 10, 15 years than we have advanced in the last whole 100 years. So this is what we need to do. We need to be aware of the latest, the best, and take from it what is suitable to our society, culture, expenditure, funds, and so on.